Dr. Sanjeev comes from Rishikesh. He is head of AIMS Rishikesh eye department. So he has come out with some yogic connection with glaucoma, open angle glaucoma. Please, sir. So next in line is Professor
Hello.
Tarannum Shakil.
Good afternoon. This is an innovative idea. In fact, the technique, the medication part is not new, but the application is an innovative. This is under pressure, like yoga technique for control of intraocular pressure in primary open-angle glaucoma, a prospective clinical trial. We all know that the treatment is, for POAG, the treatment is either surgery or the laser treatment or medical treatment. And the background of this work is that we know that IOP is influenced by autonomic activity. And autonomic activity comprises of sympathetic and parasympathetic two components. And that IOP related, the mechanism for glaucoma damage is either it is an IOP related mechanism of damage, which is due to raised IOP, leading to damage to retinal ganglion cells, followed by ischemia and thus hypoxia of the optic nerve head. Or it may be IOP independent mechanism of damage, that is increase in oxidative stress in the form of glutamate, inflammatory mediators, trophic factors, which play a significant role in glaucoma by causing mitochondrial damage and apoptosis in the trabecular meshwork, and also loss of retinal ganglion cells. So this is how this autonomic nervous system through the hypothalamus, it has a control through sympathetic and parasympathetic. And we know that eye is also being governed, controlled by sympathetic and parasympathetic. So this is just to show, just to recapitulate the connections in ciliary muscles, intrinsic muscles of the iris and epithelium of ciliary body. And aqueous humor dynamics, inflow and outflow, these are all, they are deranged, leading to an increase of intraocular pressure. So purpose of this study was that yogic pranayam and abdominal breathing are exercises which can affect autonomic activity by stimulating a wakeful hypometabolic state of parasympathetic dominance. And to learn if modulation of autonomic nervous system activity can affect IOP. So to assess the effect of pranayam breathing techniques on intraocular pressure to determine whether it can be recommended for patients of POAG as an adjuvant therapy. So, and this will lead to reduction in oxidative stress and IOP will decrease. So our, in fact, the first study which hypothesized in 2012 that meditators, persons who does meditation would have a low mean IOP compared to non-meditators due to a state of parasympathetic dominance, which is said to be established by meditation. So that was the study published in year 2014. Now it was followed by a second study, which was a clinical trial done in 2017 in POAG patients, and the clinical trial registry number is noted there. And this paper was published and published in Journal of Glaucoma and was awarded the best paper. Yogic pranayam and diaphragmatic breathing, adjuvant therapy for intraocular pressure in patients with primary open-angle glaucoma, a randomized controlled trial. It had been actually a thesis given to a candidate. So it was a prospective randomized trial, total done in 90 patients, all patients above 40 years of age. They were categorized into two groups. Group A was control, where patients were kept on medical management, and Group B where medical management plus yogic pranayam and diaphragmatic breathing exercise on a daily basis for 6 months were done. So, I mean, alternate nostril breathing, everyone actually I think is aware of this all techniques, pranayam. And second was belly breathing. Normally when we breathe, it's a thoraco-abdominal breathing, and here it's predominantly abdominal breathing, abdominothoracic breathing. One has to learn it consciously. So the outcome parameters were intraocular pressure, retinal nerve fiber layer measurement, visual field analysis. And these were measured at the time of presentation and subsequently after first 3 and 6 months of treatment. So the results were very positive, coming out, very positive results came out. In the right eye, the red shows is group A, and group B shows where the patient had these pranayam and these exercises. This is in the left eye. Again, left eye showed a decline over the 6 months. In fact, after 1 month, patient started having a decline in IOP. So the p-value is significant for right eye, and for the left eye also p-value is significant for decline of intraocular pressure. So between group and a comparison also revealed a significantly lowered IOP in this group. So the results are that 40 participants who completed the yogic pranayam and diaphragmatic breathing exercises showed a decline of more than 28% IOP in reduction. However, in RNFL, there was no change seen in 6 months' time. And similarly, in visual field analysis, there was no change was seen. Of course, there are limitations in the study. The sample size is just 90. And the cellular mechanism behind these two yogic breathing exercise was not analyzed. And long-term study and longitudinal studies are required where we can study RNFL and visual field function as well. So the take-home message is that this study provides scientific evidence for lowering IOP with yogic breathing exercises. And this involves no cost, can be easily learned, practiced by glaucoma patients, including elderly, and can reduce the need of medicines. And these can be recommended as an adjunctive therapy for glaucoma patients, along with medicines, eye drops, and can reduce the medication if the patients who are glaucoma suspect, it can be tried there as well. Thank you very much.